Hello, my name is RJ Delahaye, and I'll be doing my persuasive speech today on mental health for injured collegiate athletes. College athletes often face mental health challenges such as anxiety, depression, and stress, which hinder their physical recovery from injuries. While playing in the 5th game of the season in November, I tore my Achilles. The injury was totally unexpected because I had been playing for years without any problems. I remember recognizing right away I couldn't walk or bear weight on my leg. My worst fear was confirmed by a trip to the doctor. I had completely torn it. Although the physical discomfort was severe and sudden, it was the mental and emotional difficulties that really put me to the test. I had always been active, so I was heartbroken knowing I could not maintain that same lifestyle. The thought of being out of commission for a few months was devastating. Even if you are not a student athlete, understanding how mental health affects recovery can create more supportive environment for those athletes recovering from injuries. A study found that approximately 35% of elite athletes suffer from mental health issues related to feeling burned out, depression, and anxiety. Now imagine adding injury on top of that. Boston Children's Hospital cited that several studies have shown that injured athletes with higher levels of stress, anxiety, and fear of re-injury are less likely to fully recover. In one study of ACL reconstruction patients, those with higher levels of fear were 13 times more likely to suffer a second ACL tear within 2 years of returning to sports. Mental health supports needs to be added into athletic training programs. This would entail regular mental health check-ins and providing access to sports psychologists. Good mental health is needed to help move along the rehabilitation process of an injury. Sheltering Arms Institute reports depression has been shown to lengthen recovery time after surgery as well as delay wound healing. Multiple sources report a strong connection between struggling mental health and poorer outcomes in injured athletes. Along with poorer outcomes, mental health can also cause longer recovery times, increased rates of an injury reoccurrence, and a smaller chance of the athlete returning to the sport, and a lower performance rate when they return to sports. Imagine you commit yourself to one thing every day for years, constantly striving to be the best, and in a split second, your routine comes to a sudden stop. Athletes who have their careers put on pause by an injury often feel a loss of identity and purpose. Let's take that example. Now imagine pressure coming at you left and right from others and yourself to return as quickly as possible. Jamie Robinson, a reporter from Podestry Today, talked with various student athletes. Her finding concluded in an overall consensus that while these athletes are hurt, there are strong feelings of neglect and reports of feeling useless. Returning to play too soon increases the chances of re-injury significantly. It is an athlete's nature to push through the pain both physically and mentally in order to win. These findings highlight the importance of mental health support during recovery. Integration. Recently, Holy Family partnered with Sports Psychology Group that offers educational programs for all student athletes here. In an hour, these students and athletes learn about tools to help with mental health, time management techniques to help deal with conflict, and so much more. This has been extremely helpful for athletes here, and I can only imagine the impact this resource would have if it was available to all student athletes. Excuse me. The Mayo Clinic reports on how important reducing the stigma around mental health can be, sharing that it can give courage to individuals who are facing similar challenges to reach out for help. The Hidden Opponents is a great example of an effort to end the stigma of mental health, specifically for athletes. This organization is reaching out to campuses nationwide to spread awareness. They give resources to athletic departments and create related content for athletes. Imagine a successful team that prioritizes physical excellence with every second and dollar. Imagine then adding treatment sessions using training tools. Some argue that mental health support, while important, shouldn't be built into athletic programs for everyone. Counseling is already available on most campuses, and not all athletes experience mental health issues following injuries. Some believe requiring mandatory mental health check-ins could strain already limited resources and distract attention from physical preparation. Some also believe that athletes should be urged to get help on their own when necessary instead. In conclusion, while physical rehabilitation is necessary, it is just as vital to recognize the role that mental health plays in the recovery process for college athletes. Mental health plays a significant role in this recovery process. Think of a friend, family member, or even your favorite player, and remember that they are humans who need support to address their physical and psychological needs in order to fully recover. As a community, we need to advocate for an increase in mental health support for college athletes. This can help them recover physically, but ultimately will ensure their overall well-being in the long term. Athletes should not have to suffer in silence. It's time to treat their minds with as much care as their body. Thank you.